Hi, my name is Jeff Barry from the University of California, San Francisco, and I'm going to be talking about a study that we did at North Carolina Hip and Knee Center in Charlotte when I was a fellow. The title of the study is Irrigation and Debridement with Chronic Antibiotic Suppression is as effective as a two-stage exchange in revision total knee arthroplasty with extensive instrumentation. The goal of the study was to look at the outcomes of infection treatment in patients where they had implants that you really didn't ever want to have to take out. And the idea came from an earlier project that initially looked at the results of just INDs in revision knees. And the outcomes didn't actually end up being that terrible, so we thought maybe taking the study to the next level would be comparing it to patients who had had two-stage exchanges. This was the first study to look at these complex infections, and it's by nature a very heterogeneous group of patients, both in their history and their demographics, and that posed a challenge in designing the study, given the amount of crossover and also the prior treatments they may have had prior to inclusion. Luckily, North Carolina had access to a really large database of revision cases, so we were able to identify 87 patients who met this criteria for an infection of a revision knee with extensive hardware. And extensive hardware was defined as cones, sleeves, long cemented stems, distal femoral replacements, or periprosthetic fracture hardware, so pretty much anything you don't really like to take out. We then looked at how they did based on the intended treatment pathway, so irrigation and debridement or initiation of a two-stage exchange. The surprising findings were at a minimum of 2 years, basically the groups had equivalent infection outcomes defined as reoperation for infection. And then even more surprising was that the IND patients actually functionally were doing better. So more patients were walking without gait aids, more patients had a functional knee. And a lot of the two-stage patients ended up with fusions or amputations or never even made it to the planned second stage as a result of complications from the first. So I think the two takeaways that we wanted to stress are, number one, that in complex knees with these complex implants and infection, treatment with a modern IND, a liner exchange, and chronic antibiotic suppression can be as effective in the intermediate term as initiating a two-stage exchange in terms of controlling the infection, but also maybe even improving functional outcomes. And it should be considered in some of these patients, especially the older ones, sicker and more frail, who the morbidity of a two-stage might not be worth the small benefit. The second takeaway is this is not intended to be a comment on the more straightforward primary infections of regular primary TKAs or simple revision implants that are easier to remove. I think in those situations, the data is much more robust and would favor a two-stage for eradication of the infection. And this is really just a special population of patients where there's an added morbidity to removing these implants, and it's often a multiply operated soft tissue wound bed that probably changes the equation, and so IND may play a bigger role. I appreciate your time and hope you find the article useful in the management of this complicated patient group.